Hello, can you all hear me now? Please confirm if you can hear me.
Yes.
Yes, we can hear you.
All right. Sorry for the technical. Sorry for the technical issues. We'll start the webinar now. Let me share my screen. Once you can see my screen, you should indicate that you can see it. Can you see my screen?
Yes, sir.
Yes, sir.
Okay, good morning all. I'm Babashani Mohammed. We're going to discuss reproductive ultrasonography for clinicians. This is the content of my presentation. We're looking at the scope of ultrasonography in veterinary production, advantages. We'll cover several species, the equipment requirements, these ultrasound scanning techniques in a different species, pregnancy diagnosis, application in the male animal. By way of introduction, ultrasonography is a rapid, non-invasive, reliable tool for reproductive management in veterinary practice. In theriogenology, it aids in pregnancy diagnosis and monitoring, estrus detection, and follicular dynamics monitoring, reproductive soundness examination in both males and females, and then early detection of uterine and ovarian pathology. So before you start, you need to know the basic equipment that I used for reproductive ultrasonography. I assume that most of you have basic background on how the ultrasound machine works. Briefly, it relies on the principle of thermodynamics, which says that energy can neither be created nor destroyed, but can be transformed from one form to another. So in ultrasonography, it's an imaging modality where you convert electric energy to sound energy, and this sound energy helps you detect images of organs in the body of humans or animals. So basically what it does is it uses a probe which contains piezo crystals. Once you supply them with electricity, they vibrate at a certain frequency and generate the waves, the sound waves. And when you cast these sound waves on organs, the organs can either completely reflect them, such as hard organs like the bone or any hard tissue. Then it will now reflect the sound waves and then it will appear whitish. Or you have certain substances or organs that will not reflect. It to completely allow transmission of the sound waves through them. An example is water or any bodily fluid, like also like air. The third one is certain tissues that are neither soft, that are neither hard like bone nor transmissive like fluids. So another thing you need to know is the frequency, the principle of the frequency of the probe. So usually you have the frequency ranging from 1 to 10 megahertz. So the lower the frequency, the deeper the penetration of the sound wave. For example, if you have thick muscles as obtained in horses, the thickness of the muzzle require a frequency that is low, maybe somewhere between 2 to 3.5 megahertz. But if you have a superficial organ or tissue, you require a higher frequency, like something between 6.5 or 7, or up to 9. So depending on how superficial the tissue or organ is. Okay, so we also have different shapes of the probe, like the linear, which you use in the rectum or the vagina, and then you have the convex, which we use for transabdominal ultrasound, and then microconvex, which you use in small animals or laboratory animals. Other accessories that are required include the obstetrical glove, the lubricant, disinfectant, and the power source. Okay, this is an example of a linear rectal probe. We use them in horses and cattle. This is an example of a convex probe, which you use for just abdominal scan, particularly in small animals and small ruminants. And this is the micro convex probe, which has a wide frequency range, and it is mostly used in small animals such as the cats and miniature breeds of dogs. We also use it in laboratory animals like the rabbits or the rats. Next, we have the scanning techniques. The transrectal technique is used in larger animals. We introduce a lubricated hand with the probe to sweep across the organs, and we identify the structures of the reproductive system. In some breeds of, particularly in cattle, when the pregnancy is advanced, most of the examiner's hands cannot reach the abdomen, so we use a probe introducer, like the one shown in the image on the right side. So this helps you to reach the uterus when it is deep in the abdomen, particularly from 120 days of gestation, when the uterus is gravid and has descended into the abdomen. For transabdominal scanning, particularly in small ruminants, in swine, and in dogs and cats, the probe is placed on the ventrolateral side of the abdomen. The scan is done systematically to detect the reproductive tract. We'll see examples later on. So let's take the species one by one. We'll start with the bovine. So bovine, we usually use it to detect structures of the reproductive tract, particularly the ovarian structures. In the image here, we see the lower image, we see the live ovaries showing growing follicles of different sizes. So when you scan, you'll see them appearing as circular structures of varying diameters. On the right side, you see an ovarian follicle with a typical appearance of a dark appearance, which we which we call anechoic. Once you see a black appearance like this, it is referred to as anechoic, which means that that the structure does not reflect the sound wave that is cast upon it. So that's why it appears as black. Um, Another structure you can find on the ovary is the corpus luteum. If you look at the corpus luteum, it's not as dark as that of the follicle, because the structure is it's not completely fluid filled. So it is what we call mixed echogenicity. And then you can see the structure of the corpus luteum. In clinical practice, once you see either the follicle, which will appear black, or the corpus luteum, which appear grayish or with a mixed echogenicity, it indicates that the animal is cycling. So it will have either a follicle or a graphia or a corpus luteum. Next is the uterus. When you scan the uterus in a non-pregnant animal, you'll see the folds of the uterus as shown in the picture on the right side. This is typical appearance of the non-pregnant uterus with the uterine horns in the cattle. While for horses, it has a sliced orange or star-like appearance of the non-gravid uterus. So our primary target, once you start scanning, is to locate the urinary bladder, which is the landmark of ultrasound reproductive examination in both the mare and in cattle. In small animals, you also use the bladder as a landmark. In the first image on the left, you can see the urinary bladder on top. Then below it is the reproductive tract. For the cat, this is how it also appears. You can see two circular structures depicting the uh, uterine muscle folds in the queen. Okay, so pregnancy diagnosis in the cow. We usually start scanning for pregnancy in the cow from day 28 to 30 after breeding. So ultrasonography is one of the most important application in interior genealogy. It provides a rapid, accurate, and non-invasive method of evaluating the reproductive tract of the cows. Compared with rectal palpation, it has the following advantage. Number one, early pregnancy diagnosis. As I said, from as early as 28 days, you'll be able to detect pregnancy. Number two, we can assess whether the fetus is viable or not. Because with rectal palpation, you can only detect whether the animal is pregnant or not, but you cannot assess with certainty that the fetus is viable. So ultrasonography can help you tell you the viability of the fetus. Also, you can also identify ovarian structures, like we have mentioned earlier, the corpus luteum or the follicles. You can also detect reproductive abnormalities, as we shall see later. You can also sex the fetus. You can tell whether the fetus is a male or a female fetus. You can also age the pregnancy. So in this first clip, So from the video, you can see this is a demonstration of how to scan. So you hold the probe with your hand and introduce it into the rectum. And you can now pass it over, starting from the cervix. Immediately you pass the cervix, you'll be able to see the urinary bladder appearing as a black structure or an anechoic structure. Immediately you pass it, you'll now visualize the uterine body, then the uterine horns, and then the left or the right ovaries, where you see the circular structures. Okay, you can see how the probe is passed. You can pass it on either sides of the uterus. If you notice in this picture, the bovine uterus usually slants downwards, and the ovaries are located lateral to the uterine bodies. We'll see the difference when we come to the examination of the male. Okay, you can see as you are passing through the different aspect of the uterus, you see the appearance as circular folds of smooth muscles of the uterus. Once you don't see the black appearance, that means there's no fluid in the uterus. Or if you see the black appearance, it indicates that the uterus has fluid in it, and then you now begin looking for the fetus if it's pregnant. Okay, so I'll show you some of the stages of pregnancy, early pregnancy in the cow. The first image shows a 30-day-old pregnancy. You can see a circular appearance, what we refer to as the gestational sac, and it contains the amniotic fluid, which appears as black. Why does it appear black? Because it is fluid, and fluid does not reflect any sound wave, so it will appear as black. But if you look at the surrounding tissues, which are the smooth muscles of the uterus, you can see that it is not black completely. It is a shade of gray, depicting that the uterine smooth muscles will reflect the sound wave and they will appear as gray. So the thicker the muscle, the more whitish it becomes. Now, if you look at within that amniotic fluid, you'll see a whitish structure, and that is the conceptus. Conceptus is more like uh more, more like the embryo. Okay, you can see that it is whitish. At this point, once you see this structure, you know that the animal is pregnant, and you can measure the length of the conceptus, and that will tell you the age of the pregnancy. If you look at the figure 6 here, you see that this is a 42-day-old fetus. The embryo has transformed into a fetus. You can see the elongation of the fetus because organogenesis has commenced. Usually in the cow, organogenesis starts from day 42 to 45. So it's no longer an embryo, but a fetus. From the last image here, you can see a 54-day-old pregnancy showing a fetus where differentiation has advanced. You can see clearly that the head of the fetus is clear. The developing limbs are also very clear, and the tail. So how do you know that the fetus is dead or alive? There are some features that we see to tell you that the fetus is no longer alive. Some of the features include a lack of movement or heartbeat. For the bovine conceptus, you begin to see a heartbeat uh, of the fetus or embryo, because the first organ to develop in the whole of the anatomy of the fetus is the heart. So from the 22 of pregnancy, you begin to see the heart of the fetus begins to pump. But as I told you earlier, pregnancy check is done as early as 28 days. So from that 28 days, if you have a good machine, you'll be able to see the fetal heartbeat. So lack of fetal heartbeat indicates that the fetus is not alive. Also, we use movement of the fetus. Once the fetus is formed, that's about 42 to 45 days, you begin to see movement of the fetus. And once you see the movement, it's a confirmation that the fetus is alive or the fetus is viable. Another thing is the presence of flocculent material in the fetal fluids, signifying that the fetus is degenerating. So if the fetus dies, you see bits of flocculent materials in the amniotic fluid, which indicates that the fetus is already dead. But if the fetus is alive, you can see that the amniotic fluid will remain as a black anechoic appearance. But once you see dots of white, you know that the fetus is already degenerating because of fetal death. And then you see clear separation of the fetal structures from the uterine wall, as shown in the image here. You can see the fetus, and then there's the separation of the fetal membrane away from the uterine wall. Okay, so these are indicators of fetal death or viability. In this figure, you see a dead fetus, which appears uh, hyperechoic, and then you can see the surrounding fluid. Instead of it to appear black, it is appearing as a flocculent. It's not clear black, but you can see whitish appearance. This is an indication that there is no viable fetal membrane, and the fetus has become an unidentified hyperechoic tissue. We can also sex the fetus. Fetal sexing can be done as early as 55 days post conception and up to 110 days. After 110 days, you can no longer see the clear fetus because the caruncles will grow, the placentums will grow big, and then they will mask those structures you are looking for. So the ideal time to sex the fetus is between 55 to 70 days. It is easier to identify the males compared to the females by checking the male genital tubercle. Um, if you do not see a distinct male feature, it is important to perform a complete examination of the fetus to identify the female genital tubercle. So how do you start identifying the genital tubercle in the male? You start by identifying the umbilical cord, and you now follow it to its connection to the abdomen of the fetus. So if it is a male fetus, the you see the male genital tubercle just behind the attachment of the umbilical cord. This is indicative of a male fetus. Okay, so number one is for you to identify the umbilical cord and follow it to the attachment to the fetus. If it is behind or caudal to the attachment to the abdomen of the fetus, then you know that it's a male fetus. that by searching the genital tubercle is located in front of, not caudal, but more cranial tail. Okay, so once you identify the tail, you just follow it back, and then you see the female genital tubercle. Then you know that it's a female fetus. So in summary, you know that the genital tubercle is used to sex the fetus. If it is a male, just follow the umbilical cord, while if it is a female, just follow the tail and identify the genital tubercle. The aging of the fetus is very important because gives you the ability to sort cows into different stages of gestation so that you feed them separately. You can also observe cows around their projected times of calving, and that will give you time to prepare for any emergencies that can occur, such as cesarean section when there's dystocia. You can also optimize the dry period in dairy cows so that you'll be able to plan the dry animal transition diets. What do we use in aging of the fetus? Number one, we use the CR length, that's the crown rump length, or the head diameter, the trunk of the fetus, diameter of the trunk of the fetus, the eye orbit size, and the placentum size. These are typical images showing measurements of the fetal parts. The first one is the biperiodal diameter. Biperiodal diameter is the width of the skull of the fetus. And then the CR length is the entire length of the fetus from the crown of the head to the base of the tail. They also measure the length of the head, and then whatever you get from these measurements, in some machines they have an automatic calibration that tells you the gestational age. Once you measure it, it will give you the corresponding age of the pregnancy. But in some machines they don't have that, so you have to correspond to a particular gestational age table to tell you the age of the fetus. This is a summary diagram showing you the time to age the fetus, the time to sex it. In the male, usually start from about day 55, and you can detect the genital tubercles up to day 100 or 110. As I said, from around 90 days and above, you begin to see the placentums. Those are these circular structures, hyperechoic structures, and they usually mask the entire fetus, so you cannot see some of the fetal parts. That's why you need to do the aging, the sexing earlier than 100 days. Okay, but after 100 days, the caruncles will usually mask the fetus, and you cannot see some of those structures. Then we'll move to the mare. In the mare, transrectal ultrasonography is routinely used. We use it per rectum, and it is best to detect pregnancy in the earlier stages. Unlike the cow, you can detect pregnancy as early as 14 days in the mare. You can also confirm fetal viability. You can detect for presence of twin pregnancy. It is important in the mare to detect twin pregnancy because it gives you the ability to terminate one of the fetuses before it grows into a larger fetus.